You got accepted to Hopkins for your surgical residency. Full ride. Your mother cried when you told her. She cleaned houses for 12 years so you could take the MCAT 3 times and finally break 512. So when you arrive at the hospital at 5 in the morning on your first day, you understand what's on your shoulders. You're going to do everything right. You're going to be the surgeon who saves lives, the one people trust with their chest cracked open and their heart in your hands. The system is going to test that commitment in ways you can't imagine yet. By year 3 of your residency, you were brilliant. Your attendings tell you this. You're the first one in the OR, the last one to leave. You know the anatomy like it's written in your bones. You've done 2,000 hours of surgery. Your hands know things. Your conscious mind hasn't learned yet. Muscles have memory. Your fingers can feel the difference between a healthy vessel and one that's about to rupture. You can navigate the human body like it's a city you've lived in your whole life. But somewhere around month 8 of your 3rd year, something shifts. It starts with a woman named Alicia who comes to the ER at 2 in the morning. She's got a stab wound in her abdomen. Knife went in clean, severed something it shouldn't have. You get her prepped. You're in the OR 40 minutes after she arrives. During surgery, you find the damage. It's bad. Not impossible, but bad. You repair the vessel, you get the bleeding under control, and at 4:30 in the morning, you wheel her to recovery. By 6 a.m., she's asking about her kids. By 4 p.m., she's asking the surgeon when she can go home. That's the moment you understand your power. Not the power to fix her, the power to matter, the power to reach into someone's body and restore them to wholeness. Most people never know that feeling. You're 28 years old and you already know what God feels like. The work consumes you for the next 3 years. You do your fellowship in cardiothoracic surgery. Of course you do. The heart, the most vital organ, the one everyone's afraid of. You finish by 32. You take a job at a prestigious private hospital. The pay is good. 80,000 salary, 70,000 in bonuses for elective procedures. You're making $150 a year and you're making other surgeons wealthy. You're working 60-hour weeks. You've only seen your apartment on weekends. You haven't been on a date in 2 years because any relationship requires you to be present for more than 4 hours at a time. And you're never available. You're valuable. You're needed, but you're hollow. Then the man walks in who changes everything. His name is Marcus. He's 47, well-dressed, speaks clearly but carefully, the way people do when they're not sure if they can trust you. He comes to your office during clinic hours. Your secretary tries to stop him, but he's polite about it, and she lets him pass. He sits across from your desk. He doesn't have an appointment. He's not a patient. He just starts talking. He tells you about a world that exists parallel to the one you know, where people can't access legitimate medical care, where they're undocumented or wealthy enough that they can't afford scrutiny, or dangerous enough that hospitals report them to authorities, where people need surgery and they can't walk into an ER, where they might die without you. He's not being hyperbolic. He's describing real people. A woman who needs a C-section but will be deported if she goes to a hospital. A man with a gunshot wound who will lose his freedom if anyone documents his injury. A teenager who needs a spleen removal and whose family works in a space where asking questions of hospitals is impossible. He tells you the first one, a simple abortion before fetal viability for a woman whose legal status is provisional. He tells you he'll pay $15,000. Your monthly mortgage is $220,000. Your student loans are $480,000. You'll be paying them until you're 73 years old if things continue as they are. You tell him no. You don't tell him why very thoroughly. You're not morally offended. You're scared. You understand what he's offering, and you understand what saying yes means. You tell him you can't. He leaves his number. It's just a phone number on a piece of paper. You don't call him. But something has changed in you now. You know the door is there. You know it's possible. You know that just down the street, or in the warehouse district, or somewhere in the city, there are people who need you and can't access you through legitimate channels. You know they exist because he told you, and you believe him. And you know what you can do. You're carrying that knowledge. You've been carrying it for 17 days when your phone rings and it's the hospital's finance department. Your student loan payments are going up. The income-based repayment program is ending. Your payment in 5 years will be $1,900 a month, instead of the current $675. You do the math on the back of a prescription pad. By 50, you'll have paid $2 million toward a debt of $480,000. The interest never stops. The system is designed so that you can't escape it. You design bodies. You know how systems work. You understand now how this one is designed to keep you running in place forever. You call Marcus back. You ask him what he needs. He tells you the woman is still in the city. She's 4 weeks pregnant. She's a housekeeper, works in the Marriott downtown, and she'll be deported in 14 days. If she gets sent back to Guatemala, she'll be prosecuted for her affair with an American. The culture there is unforgiving. A baby there is a death sentence to her life. He asks if you can do it. You say you need to think about it. You don't think. You know your answer already. You're just waiting for your conscience to catch up to what your practical mind has already decided. You tell him yes. You set a date. You tell Marcus you need $15,000 up front and he needs to have it ready before the procedure. He says fine. You hang up. You sit in your apartment for 3 hours without turning on the light. You're about to do something that could end your career, that could end your freedom, that could destroy everything you've worked for. Your rational mind is screaming about this. Your body is doing it anyway. The procedure happens in a small clinic on the east side of the city. It's cleaner than you expected. The equipment is old, but functional. You recognize most of it from a teaching hospital in the Philippines, where you did a 2-week surgical rotation in medical school. The woman is there, terrified. You talk to her in Spanish, that you learned from Médecins Sans Frontières volunteers in your residency program. You tell her you're going to take care of her. You tell her it will be safe. You tell her you've done this before, which is a lie. You use local anesthesia and sedation instead of general anesthesia because the risk of complications is lower with a more conscious patient. You're thinking clearly. You're good under pressure. Your hands don't shake. 28 minutes. Technically perfect. She wakes up and the pregnancy is gone and she cries and thanks you, and Marcus hands you a briefcase with $15,000 in cash. You drive to your apartment, you sit on your bed. You're the kind of person now who commits illegal abortions in warehouse clinics. That's a fact about yourself. You're not horrified by it. You're not proud of it. You're sort of outside yourself, watching yourself exist as this person. You put the money in a safe deposit box. You use it to make a lump sum payment on your student loans. The balance drops from $480 to $465. You do the math. You needed 14 procedures to cut your debt in half. 14 times $15,000. You can accomplish that in 14 months if you stay disciplined about it. Marcus comes back with another case, then another. By month 3, you've done 5 procedures. All abortion-related. You're charging $12,000 to $20,000 per case, depending on complexity. You've reduced your student loan debt by $104,000. You're sleeping better. You're sleeping because you've made a decision, and you're committed to it. Ambiguity is gone. You were lying awake for years about whether you'd ever escape the debt. Now you have a plan. The plan involves crimes. The crimes have victims, though you tell yourself the victims are the system, not the women you're helping. The women walk away healthier. No one dies. No one is harmed. You're performing a service that's needed, and people are willing to pay for it. Month 6, Marcus introduces you to a new client. She's a woman with a degenerative liver disease. She needs a transplant, and she's not on the official list because she's uninsured and undocumented. There's a liver available. A patient at the hospital where you work. Alive. 23 years old. Motorcycle accident. Donor card says yes. The liver is destined for an 80-year-old banker who's been on the list for 3 years. The woman in front of you has 4 months to live. Marcus tells you that the banker's family will donate $200,000 to have the transplant expedited. The motorcycle kid's family will donate $200,000 to guarantee their brain-dead son's liver goes to save a young life, instead of extending an old one who will probably die of something else in 5 years anyway. You're in the hospital where you have access. You're in the OR where organs are moved and allocated. You're the only one who knows the system well enough to make this happen. You tell Marcus no. You spend a week telling yourself that you mean it. You mean it almost all the way. Then Marcus comes back with something else. Not a story, just a fact. The banker's family has already hired someone. If it's not you, it's someone worse. Someone who doesn't know how to sterilize instruments properly. Someone who doesn't understand organ perfusion. Someone who will botch the transplant, and the motorcycle kid's liver will be wasted, and the woman will still die. And the banker will get his liver because money moves systems. You're not changing the outcome. You're just making sure it happens safely. The transplant happens. The woman gets the liver. She lives. The banker's family gets their solution, and they move on. You get $200,000. Your student loan debt drops to $260,000. You're thinking in a different way now. You're not just fixing bodies. You're allocating them. You're deciding who deserves what in a system that doesn't care about anyone. You're becoming indispensable to people who exist outside the official system. By month 9, you've stopped counting how many procedures you've done. You stopped keeping records. You quit your hospital job. You told them you wanted to travel for a while. You told them you needed time to figure out if you wanted to stay in surgery. They asked what changed. You said nothing changed. You just realized some things. That's the truth. You just realized that the system you were serving wasn't serving anyone but itself. At least with Marcus, you know who you're helping. You know their names. You know what happens to them. Your apartment becomes a secondary surgery suite. You've installed better lighting. You've upgraded the sterilization equipment. You've got a pharmacy contact who provides medications at a markup that's legal but feels illegal. You're doing complex surgeries now, not just abortions. A man with a gunshot wound to the leg, you extract the bullet, repair the artery, close him up. $23,000. A child with a congenital heart defect who will die in 2 years without surgery. The family is smuggling workers from Central America. They can't go to a hospital. Surgery takes 4 hours. You stay up the entire time. The child survives. $32,000. A woman with cancer in her cervix, early stage. You do a hysterectomy in your apartment. $41,000. You're making $500,000 a year now. You've paid off your student loans completely. For the first time since you were 18 years old, you have no debt. You have savings accounts you don't tell anyone about. You have a passport with a second name on it. You have 6 months of liquid assets you could access in 72 hours. You've built the escape route and you haven't even had to use it, but you know it's there. You know how to disappear. You know 6 surgeons in 4 countries who do exactly what you do. You know how to contact them. You know the network exists, and you're part of it now. The first time someone dies, it's not your fault. It's not your fault either. She's a woman with perforated bowels from an old surgical complication. She comes to Marcus saying she needs surgery. She's too sick. Her sepsis markers are too high. She needs IV antibiotics and ICU monitoring and probably a hospital. You tell Marcus no. You tell him this one is beyond your scope. He tells you she has no other options. She'll die either way. At least with you, she has a chance. You operate. You find the perforation and you repair it. You also find that her organs are failing and the damage is too extensive, and her prognosis is terminal. She dies on your operating table at 3 a.m. You cover her body with a white sheet. You call Marcus and tell him. He comes and he takes her body away. He doesn't tell you what happens to it, and you don't ask. You keep operating. You think about her face for approximately 11 days. Then you think about her less. Then you don't think about her at all. You rationalize it clearly in the morning when you're alone with coffee and rationality. She would have died regardless. Her family was relieved she had the attempt. She didn't suffer. She died under anesthesia, pain-free, in a clean room, cared for by someone who knew what they were doing. That's better than the alternative. That's objectively true. You know it's true because you've seen people die in hospitals, with families screaming and monitors alarming, and 12 different medical systems failing simultaneously. This was quieter. This was kinder. You almost believe yourself. Month 13, Marcus comes to you with something different. He's got a wealthy man, Saudi royalty, wants a heart transplant, doesn't want to be on any official list, doesn't want his name on any records, has already selected the donor. A 28-year-old man in perfect health who can be convinced to sell a heart and live with an artificial one, which is experimental but viable. The price is $1.2 million. Your cut is $400,000. You pause for the first time in months. You tell Marcus that's not how the body works. You can't just extract a heart from someone alive and expect them to survive with an experimental device that's never been tested long term. He tells you the device is from a company and they're willing to provide it. You tell him it's too risky. He tells you that's not your problem. Your problem is whether you're willing to do the surgery. You say no. You mean it. You've crossed a lot of lines, but this one is different. This isn't about access to care for people with no options. This is about convenience for a wealthy man who doesn't want to wait like everyone else. This is about taking a healthy human and rendering them permanently dependent on a machine that might fail. This is about creating harm for profit. You tell Marcus you're done. You tell him you're closing up shop. You're thinking about leaving the country anyway. Maybe Central America. Maybe somewhere you can set up legitimate surgery. He listens. He doesn't argue. He just asks you one question. He asks how you think the legitimate system works. How do you think organs are allocated right now? Who gets them? And you know the answer because you worked in that system. Wealth gets them. Connections get them. Whiteness gets them. A man like that Saudi royalty gets them through official channels. He just has to wait 6 months instead of getting them immediately. But he'll get them. He always gets them. And men like the motorcycle kid, like the undocumented man who will die because he can't access a hospital, they don't get them. They die. They die waiting for a system that doesn't want them. So, who exactly are you harming? Who exactly is the victim? Marcus doesn't wait for an answer. He just leaves another phone number and tells you to think about it. You think about it. You rationalize it 7 different ways. You make deals with yourself about it. If you do this one, you'll stop. If you do this one and the artificial heart works, you'll prove something worth proving. If you do this one, you'll have enough money to disappear to somewhere legitimate and never do this again. If you do this one, you do it. The Saudi lives. The 28-year-old lives. The artificial heart works, and you have $400,000 and no more excuses. You're 39 years old. You've performed over 200 surgeries outside of hospitals. 47 people have died. You've told yourself that number is acceptable. Statistically, your survival rate is better than most hospitals. That's technically true. That's also a lie, because you're selecting for easier cases and healthier patients, and you're not accounting for the severity differential. But you don't think about it that way anymore. You think about it the way that keeps you sleeping at night. You think about it the way that keeps you functional. You've become indispensable to a network of criminals, not violent criminals, not men who hurt people for pleasure, men who've built a system that exists in the spaces the legitimate system abandoned. You're not a criminal. You're a surgeon. You are just a surgeon who works outside the law. That's what you tell yourself. You almost believe it. And somewhere right now, another surgeon is sitting across from another Marcus. Another brilliant person is looking at another briefcase. Another person who came from nothing, who fought to matter, is realizing that the system they served doesn't serve them either. And they're deciding whether the person in front of them is asking them to help people or to become a different kind of person entirely. They don't know yet that those are the same thing. They don't know that once you cross the line, there's no line anymore. There's just a road that keeps going, and you keep walking, and you keep telling yourself stories about why the walking is justified. And that story is the story you're telling yourself right now. That's how you got here, and that's how the next one gets here too.